Thank you, Ankit. Thank you for the intro. So, uh, good afternoon, everyone. And I would like this session to be very interacting. So, people, whoever has been joining the um, whole session, can talk, can ask me at any time, whatever they want to feel, they feel like asking me. Okay. So, am I audible to everyone? You can say to whenever if there's some problem, you can tell me, ask. So a very good afternoon to all of you. So I am Dr. Sayash, and I am going to talk about vaccination across every age group, a guide to life from protection. So before starting the topic, I just wanted to ask, when was the last time you heard about or you thought about vaccination? Anyone, someone can tell, whoever is there online can tell me, when was the last time did you think about vaccination? Yeah, COVID was one, obviously COVID. And the second is during your childhood times, when you used to get a lot of needle. And that so with the end of this session, you will come to know that it was not just childhood. In adulthood, in teenage, everywhere you have to get some of the other vaccinations. So let's move forward. So when you hear the word vaccination, what's the first word that comes to your mind? What is the first word that comes to your mind? Multiple things, and you can just type in the chat box. Yes, prevention is yes. Safety is there, yes. And something else anyone wants to add? I think most of the people are missing out one important thing, is that is the needles, the fear of needles. So it was the worst thing which came to our mind when we heard vaccination. But all this prevention, safety, all the things, they connect us to a central idea of prevention. And that's what I'm going to talk about in the subsequent slides. Let's go forward. So who thinks vaccines are mainly for children? Is it only for children? So most of the people, we know that in COVID times we got adults also got the vaccine. Yes. So it is for different age groups, different vaccines are available. And with the newer advancement in medical line, I'll talk about much more in details. So let's go forward. So why prevention is better than the treatment? So we have made two tables why prevention is better than the treatment. So when it comes for the prevention, it is simple. So with just a vaccine, you will get prevention. And the treatment part, it is complicated. It takes time, it takes higher cost, it is more stressful, you take a lot of time to recover. But if you just take the vaccine, it is simple, it is lower cost, less stress, fewer complication, and better quality of life. So vaccines are one of the best preventive tools available. And as we know, prevention is always better than the cure. Okay, so let's go forward. So why vaccination matters across the life stages? So this is a very important thing to talk about. So when we were child, when we were young, we used to play in the mud. At that time, we did not have immunity. So we used to play in the mud, and we got more infections, and with time we got more immune to all the ailments. So our immunity just starts to build up from the young age. And once we become an adolescent age, we become adults, or in the teenage time, we have a higher social exposure in which there can be sexual exposure also. So all these can cause many immunity change, and also the change with the ages, the body change, everything adds up. In adulthood, we work more, we travel more, so there are risks involved. And in the old age, our immunity becomes weaker and weaker with the increasing age. So, which means our vaccination needs to change also with according to the age. So, next slide. So, your vaccine protects, when you take a vaccine, it protects more than just you. So, it protect your children, it protect your spouse, it protect your colleagues, it protects the whole society, it protects the elderly members at your home. So there is a concept of herd immunity. So herd immunity is a very good concept in which that if a big group of people, if they are vaccinated, so the whole community and in the subsequent generation, the prevalence of the diseases decreases. Like you see in cases of polio, measles, the if, because of higher vaccination at young age and higher number of vaccination, so now the cases has gone up to 0 to 1%. So that's what the impact is. When you take a vaccine, it impacts all the ones who are around you. Okay, so next slide. So who are the people you protect and you get vaccinated? This is a very interesting question. So please type in the chat, who are the people you protect when you get vaccinated? Nice. Your family and your colleagues. Because if you're sick, you tend to make your friends also sick. Yes. Nice. So moving on further. So this is what I was talking about. One vaccines create a chain of protection extending far beyond ourselves. So this is very important. So this is what I was talking about, the herd immunity and all. So one person gets vaccinated, multiple person gets the benefit with that. Okay, going on further. Next. So the vaccination journey, as I told, because of different age groups, the vaccine need is also different. The childhood vaccinations are different, teen and young adult vaccines are different, adult vaccines are different, and middle age to older age vaccines are different. So basically, from childhood to old age, the vaccination, it isn't a journey. It isn't a destination. It's a journey. So it is gradually changing all the vaccines and getting booster doses. So moving on further. So first, we'll talk about some childhood vaccines. So what are the most common childhood vaccines you have? No. Hello. Am I audible?
Yes, sir, you're audible.
Yeah. So I think you can turn on your mics, everyone. So you can also keep on asking and answering also, rather than just typing on the chat.
The thing is that people can't turn their mics. So once they need to talk, they need to raise their hand. So once they raise their hand, I will allow to talk. Or else they can put
Okay.
their questions in the chat box.
Okay, fine. So what all childhood vaccines have you heard about? Typhoid is one. Yes. Typhoid is one. Very important vaccine. And what else you have heard about? Polio is one. Tetanus is one. Hepatitis is one. Yeah. So hepatitis A vaccine is actually a very, yeah, yellow fever. For yellow fever, Africa one vaccine. Yes. Nice. So many vaccines you know. So hepatitis B is the most important thing which we need to uh, stress upon. Malaria vaccine is there, yes, but better than malaria vaccine is the prophylaxis which we give. the tablets which we give. Malaria vaccine is not very much working in the Indian population, but in foreign population, in the European population, it works wonders. Okay, so as you have all told, the first vaccine is polio vaccine. So polio virus was very dangerous virus. It used to cause fully muscle paralysis. All the muscles got paralyzed, and which caused them to unable to do their regular walk, talk, and routines. I have seen a very dangerous polio case in which the vocal cord paralysis was also there. So it was in a child who was not vaccinated in the early days. I used to work in Chhattisgarh. So at that time, we used to get one or two polio cases, and we had to tell the government about it. So I've seen polio, and polio is very dreadful. Once it affects you, it is lifelong. There is lifelong paralysis. And next vaccine is the MMR. MMR is mumps, measles, and rubella. So most of you might have saw in childhood that when you were children, your friends or you might also had swollen area behind the ears when you had some cold and cough. So that was mumps, which was a viral fever. And measles is rashes all over the body, which is same like chickenpox, but chickenpox rashes contain fluid in it, and measles rashes are more red in it. Rubella is BCG in adults. No, BCG is always given in the younger. As soon as the child gets born, we give BCG and vitamin K vaccine. So BCG is not recommended for adults. And also BCG is not very good vaccine to fight against TB. So many people, pneumococcal vaccine is very nice, very good vaccine. I'll talk about it. Pneumococcal, influenza, flu vax, everything I'll talk in the subsequent slides. So next is the DTP or DPT or Tdap. So DPT, DTP is all Ram and Sham. DPT is diphtheria, pertussis is for P, and T is for tetanus. So tetanus as a injection which we go and take. So you know what duration we should take the booster dose of tetanus? Anyone knows? Just type it. Tell me. How long? Someone has written 3 years. Someone has written 6 months. Okay. So the company says, the tetanus, the DPT, the Tdap company, they says 7 years. And we in emergency department, we always recommend 5 years. So if you have taken right now in 2026, you will be vaccinated till 2031. Okay. So keep in mind. So once you get vaccinated for tetanus, you don't need to go bar for every small cut to the hospital for getting a tetanus shot. Okay. Also, for getting a tetanus vaccine, the wound should be soiled. Means the soil should be there, or it should be a rusted item. But many people come to the emergency department with a small cut, and they come with chaku and all, and they come and tell ki, Erika, dear, I want tetanus. So it's not like that. So once you get vaccinated, you are vaccinated for 5 years. So keep in mind and tell others also. So earlier it was a misconception that every 6 months you need to take tetanus. Even some doctors used to tell, but now it's a evidence-based thing. Next is the last one is very important. That's a hepatitis B. Till what age? Okay. So in young age, in childhood vaccines, DPT is included. So one is given at 6 weeks, one is given at 5 years, one is given at 10 years, and one is given at 15 years. So till the age of 18, that means every child who is fully vaccinated till the age of 18, that child doesn't need to get a tetanus vaccine. Okay. And coming to the most important vaccine, that is the hepatitis B, which is a very dreaded thing. Hepatitis B can be contacted with change of any body fluids. So it can be a blood exchange, it can be a sexual contact, it can be anything. So you can contact hepatitis B with needles, syringes. Okay. So hepatitis B is very important, but it is more important in medical workers than small children. But hepatitis B is also nowadays it is given in childhood. It is added in the childhood vaccines. Okay. Anything you want to ask? What are symptoms and how hepatitis affects? So hepatitis. Okay, we'll answer one by one. So hepatitis vaccine is one you take today and one you take after 1 month. Then you have to so after 1 month you take the booster dose, and then one you take after 3 months. And after the thing, just I'll talk about first hepatitis, then we'll talk about the tetanus. Okay. So hepatitis we take like that, and whenever you get a prick, whenever you have some uh, suspected infection, what you go and do is you just check your antibody titer, because if you have taken the vaccine before, your body might have formed antibodies against the hepatitis B. If it is more than 10, you don't need to do anything. Okay. So this is how hepatitis vaccine works. Next is the symptoms. So if you get infected by hepatitis B right now, it takes around 10 years to show the effect. It's same like HIV and AIDS. So it almost takes 5 to 10 years to completely show all the things. So your liver gets affected. Hepatitis is hepat means liver, and itis means infection. So it is basically the infection of the liver, and we cannot reverse this. And for tetanus, the major accident protocol, yes. If it's a major accident, if it's a road traffic accident, we give tetanus anyways. Okay. Because at that time, the person who is involved in the accident may or may not be in a state of mind to tell about the vaccination history. So it's a thumb rule that we give tetanus during the road traffic accidents. Okay. Anything else? Thyroid. No, thyroid is a endocrine disorder. There's no vaccine for it. Yes, but there are multiple lifestyle modifications. So every endocrine problem, that is thyroid, diabetes, and many more, adrenal insufficiency. So all these are associated with genetic factors, and also it can happen idiopathic, means the proper cause may not be known, but there is no vaccine for thyroid for the time being. But after 5-10 years, we may have a vaccine. Okay, moving forward. So childhood vaccines. So why they are important? Because they are the foundation of the immunity. Yes, they are the foundation of the immunity. A fully vaccinated child gets lesser sick, and the graph of the child is always better. It's a known study. It has been done by the pediatric department of AIMS, and it has been confirmed that the vaccinated children do better, because the time they lose in getting sick, it gets reduced, and it ultimately it adds up to their performance. Prevention of severe diseases. Yes, I have seen many children dying because of some illness which could have been prevented from vaccines? Yes. Long-term health protection, obviously, if these healthy children grow up, they become a good asset for the community. Okay. Any other questions till now? Okay. Moving forward. Now, coming to the young adulthood, this is more of the teenage time. So here, what the problem is, there are multiple others. So as I told, tetanus booster vaccine. So Tdap booster is there. Annual flu vaccine. So flu vaccine. How about influenza vaccine? Yes, I'll talk about the influenza vaccine. I'll show you the influenza vaccine which I also took. So there are multiple vaccines in adulthood, that is the teenage years. So one very important vaccine is the HPV vaccine. HPV stands for human. I hear because of more vaccines these days, kids become hyperreactive. Is that true? No. Children become hyperactive because parents are giving them more screen time. So more screen time, more dopamine release from the brain. More dopamine release, more hyperactive the child is. So because of that, it is creating more autism, more hyperactive disorders in the children, more abnormality in the children. So HPV is human papilloma virus. Very nice, very nice. Everyone should know about this. This vaccine protects against a certain cancer, and that is the cervical cancer, which I'll be talking in the subsequent slide. So moving forward. So why HPV vaccine? Because as I told, it is actually very much productive. It can save millions of lives if given. HPV is for both girls and boys. It is for both girls and boys because right now it is more exposure, maintaining immunity. Yeah. Okay. So this is one of the vaccine which can help prevent cancer. As I have given up the thing, I would have asked you the thing, but there are many more vaccines which they are working upon to act on certain cancers which can be prevented. One is the adenocarcinoma of the stomach, which Japan is trying to uh, bring out. Most probably by the end of this year, Japan will bring it out. So it is for the stomach cancer. They are bringing one vaccine. And HPV vaccine, there are multiple vaccines in the market, but which vaccine to take, I'll tell you. Next slide. So HPV stands for human papilloma virus, as one of the friend has rightly answered. So a very common virus, it's a very common virus through close skin to skin contact and sexual contact. So most people will be exposed with the HPV at some point of their lives. So what happens is your body tends to fight with it, and if the body fights with it, the HPV won't react. But at some time when your immunity is low, that HPV can cause cancer. Okay. So the most high risk people are the women of 23 to 45 years of age group. So there are multiple studies which tells that HPV vaccine should be given in young teenage girls. It should be given as fast as in 9 to 10 years. From 9 to 10 years of age, we can give the HPV vaccine to the children. Okay, moving forward. So this is Gardasil 9. So that 9 stands for 9 variants of vaccine. of the strains of HPV that it helps to fight with. So there are 9 strains of human papilloma virus, and it is effective against all those 9. So this is the most recent vaccine in the market, and you can get it done. You can take it with the help of a gynecologist or a internal medicine doctor. You can take it. So you don't need to go for the same brand and all, but Gardasil 9 is the best in the market right now. Okay. Next. Next slide. Oh,
So
one
it's
slide
changing,
before.
right?
No, you just skip one slide.
No,
Yeah. So the reality is, see, I have put some statistics over there. So more than 1.27 lakh women are diagnosed with cervical cancer every year in India, and nearly 80,000 women lose their lives to the disease annually. And with this, I would suggest all the women who are in the group to go for routine 6 monthly pap smear with the gynec. Get yourself checked more often. If you are if the pap smear comes negative, then you can wait for another 1 year and get every yearly checkup. But if it comes positive, you can catch hold of the cancer at the very early stage. You can get it treated also. Okay. Any questions? Yeah. So HPV is for both girls and boys, but at what age? The best age is from 9 to 15 years of age. But if you have not taken, we can give HPV vaccine from 23 to 45 years. Yes, a 30 years old lady can also take a HPV vaccine. But the thing is, you have to go to a gynec, and according to your body type, they will suggest you a vaccine. Okay. Okay, fine. So regular screening is what I told. So regular screening is the pap smear, and pap smear needs to be done on regular basis. Just a moment, I'm taking some time. Just a second. Yeah, it's raining out here a lot. Okay, fine. Next slide. Any questions up till now for HPV or something like that you want to ask? So now coming to the adult vaccines. So adult vaccines, there are multiple. One was the main important vaccine was the COVID vaccines, which we all took during the COVID times. And then there is flu vaccine. Then there is hepatitis A and B vaccine, typhoid vaccine, and there are multiple vaccines which we give to people who are going to some specific countries, like yellow fever. One of my friend has messaged here. Yellow fever, for sleeping sickness. Multiple vaccines are there. Okay, so let us go for all the vaccines. So first is going next. So first is this vaccine, which is the Influvac. The Influvac is for the influenza vaccine. So you might have noticed that every year, one particular month, everyone gets sick. Everyone has a running nose. Everyone has some cough. Everyone has some fever, and 1 week of your month is getting hampered because of this illness. Okay, this is a common cold which we say. In medical term, we call it influenza. So this particular vaccine, I've taken it last month. So this vaccine, Influvac, this is a quadrivalent vaccine. Means this has a vaccine which is effective against 4 subtypes of the influenza. So every year, this virus, it's a viral fever. So this virus tend to be very smart, and every year it changes its genetic structure, and the so our immunity is not able to fight against it. So you can take it around just near the monsoon every year. So you'll have to take every year this vaccine. So this is the 2026 variety. Now next year the 2027 variety will come. Okay. So one quick question to all of you. Do we need to take antibiotics during the flu? Is it necessary to take antibiotics? Or should I say, do you take antibiotics during flu? Ideally, no, but we take. And that's a very wrong practice because this is a viral fever and antibiotics has no role in fighting a virus. Okay. And because of antibiotic insensitivity and resistance, this is causing resistance. And nowadays, all the bacteria which are coming, they are very resistant, multi-drug resistant, and antibiotics are not working properly. So make sure while you have cold or a normal fever, it is not indication for taking antibiotics. Okay. Any specific question for anything till now? Okay. Moving forward. So adult vaccines. So the most important, why we need adult vaccines. So one is the workplace exposure. So you work in an office, one of you get infected by a viral fever, whole office gets infected by the viral fever. You travel from your home to your office place, you get infected by the other people during the travel. So that's why the vaccines are important, and booster doses are also very important. So taking vaccine once is not enough. So you'll have to continuously take the boosters along with it. So it's just like your mobile. So you keep on updating your mobile system. That's how you take boosters. So booster is the newer version of the vaccine. It helps for fighting the next newer thing of the newer variant of the virus. Okay. Next. So now coming to the middle age and senior years. Okay. Any question till this? Okay, whatever the vaccines given by the government is enough to the children, or any other mandatory vaccine to be taken. See, government has given their protocol for the vaccination is actually very good. So whatever the government has given you on that vaccination card, it is mandatory for all the children. And if you want to be extra sure, there are many more vaccines which have come in the hospitals, which you can take with the help of your pediatrician. So ideally, I would suggest you to get a pediatric reference and then take the extra vaccines. But the government vaccines, they are more than enough. So I've worked in both a government setting and in a corporate setting. So vaccines, pneumococcal vaccine, these all vaccines are very important and should be given to the children. Okay. So now coming to the middle age and senior years, which is the most important sect of the people who can get easily infected by the disease, and also they are the one who are more vulnerable for it. Okay, and for the complications also they are more vulnerable. So first is the shingles vaccine. So shingles is nothing, it is herpes. So the herpes, that the lesion is very characteristic. I'll help you out with the diagnosis. By the end of this, you can become a doctor. Okay, so I'll help you out with the characteristic. So the lesions of herpes, it is white lesions, and it doesn't cross the midline. That means अगर ये body का midline है, तो एक side में ही it will be there. Okay, it will be either on the left side or it will be in the right side, but it will never cross the midline. So it will never happen in both the sides. It can only happen on one side. Okay, and it is very painful, and you might have got herpes somewhere sometime, or you might have uh, had a talk with someone who had herpes before. So herpes is very painful, and it involves the nerves, so it is that painful. Okay. It never crosses the midline, it is always on one side. So it is very important for senior people to take herpes vaccine, because they are the one who are more susceptible and vulnerable to contract herpes. Okay. Second is pneumococcal vaccine. Pneumococcal vaccine is for pneumococcus subspecies, which is the most common cause of pneumonia in old people. So it protects against serious lung infections. But the thing is, there are multiple other bacteria that can cause pneumonia. It's not कि pneumococcal vaccine लेने से you won't get pneumonia in future, but there are multiple other organisms, but those organisms causing pneumonia is very rare. So this pneumococcal vaccine is very good for old people. Okay. Next, coming to the RSV, that is respiratory syncytial virus. So this is for also viral pneumonia for people who are having diabetes for long time, who have cancer for long time, who are having hypertension, that is BP, high BP blood pressure for long time, or they are cardiac patients, or they are having some neuro ailment, or they are bedridden. These people are more prone to these infections and ideally needs this vaccine. Okay. And annual flu vaccine, which I've already discussed about, it is very much important in everyone. Okay. So all of you might should take influvac at some time. So annual flu vaccines I've already talked about. Okay. So coming to the next slide. There are some question answers. I'll answer to them afterwards. Okay. Okay. Next slide. So coming to why are they essential? It is very common thing for old people that their immunity getting lower with the age and with the comorbidities like diabetes, hypertension, cardiac, neurological ailments, multiple things. So because of this, their immunity gets decreased and they tend to contract more diseases. So we give these vaccines to reduce the severity of the disease, and also this will ensure that their aging is healthy, and they are healthy and they age normally like everyone. Okay. Okay. Coming to the next slide. Okay. Before this, I'll like to take upon two questions two anonymous attendees have asked. The first one is I recently came across reports about counterfeit rabies vaccine in India. Yes, and I'm a bit concerned. Okay, how can patients be sure that the rabies vaccine they receive is genuine? Is there a way to verify the brand and batch number? Also, can we generally trust the vaccine supplied through government hospitals are authentic and properly sourced? Okay. So this is very nice question, and ideally, actually, this answer should be given by the government. But the best thing for the rabies right now, rabies WHO protocol, I'll tell everyone. So there are three categories of a bite or a scratch. Okay, it can be a bite from the teeth, or it can be a scratch from the claw. Okay, so there are three categories. One is just a lick over the skin, which is considered to be a category 1 bite. Okay. Second is a small cut or a small scratch, but no blood is coming out. It can be even a pre-existing wound getting licked by a dog or a cat or any animal, be it. Okay. So that is category 2, and it needs vaccine. Okay, and category 3 is when you get a good amount of bite, and there is blood. Even if there is a single drop of blood, it's a category 3 bite. Okay, so what WHO recommends right now is a 5-dose vaccine. So one you take on, so if today you have taken the first vaccine, then next vaccine you have to take after 3 days, then 7 days, then 21 days, and at last 28 days. So this is how the vaccine works. Okay, and if it's a category 3 vaccine, so with the first dose of vaccine, you need to get a immunoglobulin with the vaccine. Okay, so immunoglobulin is given around the wound. So regarding this rabies vaccine, which was counterfeit, they were Aberab vaccines, and only from particular month to month, from I think February 25 to November 25 was the counterfeit one. So in between those who got bitten, and we gave the Aberab vaccine, we called them back and we gave them the vaccine again. Okay, so most of the bites which come to our setup, they usually doesn't have rabies. Yeah, but the thing is, rabies is 100% fatal, and if you get rabies, if you contact rabies, you are going to die. Okay, so never, even if your dog is vaccinated, if your cat is vaccinated, if your pet is vaccinated, still WHO recommends to take all the dose of vaccine. Okay. Any doubt regarding rabies or anything you want to ask? Rabies is a very important topic, but it doesn't come in such a way, but it needs to be talked about. It's a very good emergency. A dog bite and a cat bite or a bear bite, tiger bite. If it's all an emergency, we usually get all these in our emergency department. So it is very important. And only animals which you won't get rabies are the birds. All the birds, be it any bird and be it any rodent. Rodent means rat, squirrel, mouse. Any rodent biting you won't cause you rabies. And any bird, peck or the claw, anything won't cause you rabies. Rabies is always caused by mammals. Okay, even cows, buffaloes, every animal can give you rabies. Okay. So next question Covishield. On my way, I knew it. In blood vessels, is this true? If so, how common is it? Who is at risk? And does the risk exist only in the first few weeks after vaccination? Or can it occur years later? Based on the latest scientific evidence, should people who received Covishield be concerned? See, this have been a very commonly misunderstood topic amongst everyone. Even in the medical fraternity, many people were of an opinion that Covishield caused clots and sudden cardiac death, multiple strokes, heart attacks were very common after the COVID era. So AIMS, NMC, and ICMR, they collectively conducted a study right now. Okay, so in that study, it has been clearly specified that all the COVID vaccines, people took COVID vaccines, none of them, uh, there was no relation between the vaccine and the clot. Okay, so it has been a known, now it has been a proper study. The study is available. Just type on the Google AIMS and ICMR study. You will find out. So there is no relation between the thing. But yes, Covishield, which was made by AstraZeneca, it had a complication in which the platelets tend to go down, and there was a risk of getting a clot, but it was very rare, and it was only documented within the 30 days after taking the 30 to 45 days after taking the vaccine. Okay, so it was a known thing. Okay, so Covishield can cause, but it will only cause after 30 to 45 days, only within that time, and it is very rare, almost like 1 to 2%. Okay, how fast someone can go contracted to rabies, how soon we should get. See, the medical thing, the studies say that you have 7 days, that is 1 week. Okay, but once the animal which bit you dies as soon as it bit you, so the suspicion for rabies is very high. Okay, so whenever you get bitten by any animal, keep a watch on the animal. If the animal gets if it dies within next 24 hours, then the chances of rabies are very high. Okay, so you should get vaccinated as soon as possible, but if by any chance you have to delay, you can take up to 7 days. Okay, any questions? I have answered every questions, I guess. If someone want to ask questions, you can ask, no issues. Then if everyone is fine, then we'll go forward. List of vaccines. Okay, what I'll do is I'll give a proper list of vaccines from childhood to old age, uh, to Trijo, and what they will do is they will give you that list. Okay, so proper vaccine list which should be given, which you should properly get, I'll give you. Okay, fine. So for the must take vaccines for 30 plus men. So must take for the time, the need of the hour is Influvac, which I told, which I also took. Okay. For women, obviously Influvac, HPV, even for men also HPV, because if you are safe, you can not give to another woman. So unmarried men with multiple sexual partners, ideally you should take HPV vaccine. Okay, and right now pneumococcal vaccine is also very much on the surge, and many people are taking, because there have been multiple cases of young people getting pneumonia increasing in Mumbai suburbs. We were conducting a study, and we have seen that there is an increase in number of pneumonia in young guys. Okay, and that too in men, the risk is higher. So any other questions? HIV prevention in terms of vaccines, they have been working. Russia is working, and I think Brazil is working. But the thing is, it hasn't been approved globally. FDA has not approved it, so it's still in the phase. But HIV prevention, it's a very good topic. Every hospital right now, they have a needle stick injury and HIV thing. So there are drugs which are there which we can take within 24 to 72 hours for prevention of HIV. If you have a suspicion that you got HIV, you got exposed to HIV, we can give you the tablet and you have to take for next 1 month, and then we can prevent it. But only within the 24 to 72 hours. Okay. So now coming to the boosters. So boosters are like updates, as I told. So as you update your phone, you service your car, you upgrade your software. It's just like you recharge your immunity with the new vaccine. So a newer form of the vaccine, and the vaccine also works with the newer form of the virus. Okay. So it also needs maintenance, and because of the boosters, your body fights back the infection. Okay. So let's go fast. Next slide. So now we'll play a quiz competition. So now till this point, I think most of you have been educated. Now you have become a young doctor yourself. So let's answer like a doctor. Okay. So this is guess the disease game. You'll have to guess the disease. So there's a 32-year-old guy, Rahul, returned from work, feeling tired and slightly feverish. By the next day, he developed body aches, chills, headache, and a high fever. Soon, several colleagues in his office also fell sick. So what is the answer? Very good. Nilesh has won the quiz. We'll give him one chocolate. Malaria doesn't come within 1 day. Yeah. But malaria won't be very much. Malaria won't be like all the several colleagues won't be getting sick also. So malaria is a vector-borne disease. That means if you have malaria, you got bitten by a mosquito, then that mosquito bites you, you get malaria. Okay. So answer is what answer? Let us see what the answer is. Oh, so answer is influenza. So Nilesh has won the thing. We'll give him chocolate. Whoever is the head, I would ask him to give him chocolate. Okay. So symptoms are fever, body ache, fatigue, chills, cough. So it's the normal common cold, which we call flu. Okay. Next slide. So annual flu vaccine, which I told, Influvac, the 4 quadrivalent vaccine is the best vaccine right now. You can all take it. Okay. There's no fever, nothing, just a little pain on the site of the injection, but that also vanishes within 1 or 2 days. Okay. So this you have to take yearly. So 26 one, then 27 again the virus will change its strain, its genetic material, and then again the new vaccine comes in the market. So you have to take that. Okay. Next. So now next is Sham suddenly developed a painful burning sensation on one side of his body. So one side is very important. A few days later, clusters of blisters appeared, making even wearing clothes uncomfortable. Okay. Wow. Nilesh can join me in my emergency department. I would, and also Samruddhi, she is also answering. I would suggest both of them joining me in the emergency department. Okay. So as I told, on one side of his body and few blisters appear, making even clothes wear uncomfortable. Even lying on the bed makes it very uncomfortable and very painful, and people cry out in pain. It's that painful. Okay. Let's see the answer. Answer is shingles. Nice. So burning pain, tingling, blisters, skin sensitivity. Next. So shingles vaccine is there. So usually most aged people or even people who are taking care of people who have herpes, they can also contact it. Okay. Next question. So Amit, a 40-year-old, returned from a trip and developed prolonged fever. Okay, weakness, stomach discomfort, and loss of appetite. His doctor diagnosed an infection caused by contaminated food. Oh my God, Nilesh is on spree. He doesn't even need to. So diarrhea is actually a symptom, but this is a disease. So contaminated food and water is, yeah. Food poisoning, yes, food poisoning can be an answer, but the answer is, I think, typhoid. Okay, let's see the answer. Yeah, so typhoid fever. So here the main thing was he returned from a trip. So usually typhoid is known as the traveler's diarrhea. So whenever you go to some place, you eat food, you drink water from there, it gets contaminated by typhoid bacteria, that is Mycobacterium typha. So Salmonella typha. So Salmonella typhi, that causes typhoid fever. Okay. So persistent fever, weakness, abdominal pain, loss of appetite. And in severe cases of typhoid, we have even seen the guts being penetrated. Okay. Sure. Next. So typhoid, we have typhoid vaccine we can give. And for this prevention, while going outside, you have to eat safe food, clean drinking water, and good hand hygiene. Always practice this while going to places like this. Okay. Next. Oh, so now a 5-year-old Arav had a cough that just wouldn't stop. Okay. During coughing spells, he struggled to catch his breath and made a characteristic whooping sound. Yeah. So whooping sound, this is actually a little more of a medical thing right here. I think most of you don't know this, but this is whooping cough or pertussis. This is more common in children. So how there's a characteristic dog-like barking. So they cough like dog barking. So when they cough, you feel like they're barking like dog, and this is called pertussis, which is whooping cough. Just what the answer is. What the answer? Pertussis. Yeah. So this gets covered by the DPT vaccine, that is the diphtheria, pertussis, and tetanus vaccine. Okay. So severe coughing fits, difficulty breathing, characteristic whoop, and vomiting after coughing. Okay. Child coughs too much that it causes vomiting. Next. So DPT vaccine, DTaP boosters, we have to take the boosters also for children. Okay. And children and adults both need protection, and booster doses are very important. So once you get in like you get vaccinated during the childhood, you don't need to take it bar. Okay. No side effects of this vaccine. Okay. Most common side effects of all the vaccines combined is usually a fever and pain on the site and some body pain and all. This is the common side effects of all the vaccines. Okay. No major side effects. Next. 23-year-old Priya was preparing for a cousin's wedding, okay, when she suddenly developed fever, running nose, red eyes, and a rash that spread across her body. HPV, Nilesh will see. Let's see. She had never completed her childhood immunization. This is the thing. She has never completed her childhood immunizations. She has a rash all over the body and running nose. All these goes in favor of either two things. Either it's a chicken pox or it's a measles. Okay. HPV is, yeah, measles is correct. Samruddhi can also join my emergency team. No problem. So answer is most probably measles. Let's see. Answer is I think answer is going to be measles only. Yes. So high fever, skin rash, red eyes, runny nose. It can be chickenpox also, but here she had never completed a childhood immunization. Gave us that. So for measles, which vaccine was it? It was, as I told in the initial time, it was MMR. That is measles, mumps, and rubella. So next. So rubella is also a very important disease in mothers if they have rubella and if they are pregnant while having children, they tend to have multiple complication in children if mothers have rubella during pregnancy. Next. So MMR vaccine, mumps, measles, rubella. Measles are highly contagious, yes, but vaccination provides excellent protection. So most of us, we don't have measles right now, but if your childhood vaccination was incomplete, you might contact measles. Okay, so if you are unsure about it, you can go to a medicine doctor and get it done. Next. So let's now talk about some myth or fact. Let us see, uh, is it a myth or a fact? So adults can also suffer from diseases we usually associate with childhood. Is it a fact or a myth? What do you think? Adults can also suffer from diseases we usually fact. Correct. Fact. Yes, it looks like fact. If you are not vaccinated properly, you can get it in adulthood. Sure. Next. Yeah. Yes, chickenpox can appear at any age. I got it last year. So it can happen at any age. Okay. So as the age progresses, the severity of the chickenpox uh, increases. Okay. So more severe the chickenpox is, more painful it is as the age progresses. Next. The flu is just a bad cold. Is it a fact or myth? The flu is just a bad cold. It's a myth. Correct. Correct. But also it's a fact, it's a bad cold only. It is very bad, but when it happens, it hampers all the thing. But yes, it's a myth because it's not just a bad cold. Okay. Take it. Next. I never get sick, so I don't need vaccines. Wow. Yeah, many people during the COVID time had this thing. I never get sick, so I don't need vaccines. Is it a fact or a myth? Yes, it's a myth. Anyone can get sick at any point of time. So the disease never tell that it is going to come, and it will have to be prepared for it before. So ideally, we should get vaccinated before. Okay, so it's a myth. Next. Vaccination is an act of self-care and community care. Obviously, it's a fact. Is it a fact or a myth? Fact. Obviously, it is a fact. So you take care of yourself and also people around you. So ultimately, it's a community care. It's a fact. Yes. Next. Once vaccinated, protected lasts forever. Protection lasts forever. Is it? During the COVID times, did you only get vaccinated once? Or how was the vaccination done? It's a myth. Correct. You'll always have to take booster doses. Booster doses are meant for that. Okay? Good. Let's move forward. Let's move forward. Okay. Traveling abroad may require additional vaccines. Yeah. Is it a fact or a myth? It's a fact. Yes. So traveling to African countries, we usually give many vaccines. Yellow fever, multiple vaccines are there. So we give that to people who go for Africa and so lower socioeconomic status countries. Whenever they go, we give them. And similarly, all the European and the American countries, when they come to India, yeah, traveling to Pak needs polio vaccine. Correct. It's a correct. So number of polio cases are more in Pakistan. Next. So after this session, what action will you take? That is the best question which I would ask you. Yeah, vaccination is important, but uh, will you be taking it as soon as possible, or will you think about it? Okay, so let us talk about the takeaways. So the most important takeaway is that vaccination is going to be for lifelong. Immunity changes with the age. Boosters always matter. Prevention is always better than the treatment. This last point is very important because every week in emergency department, I see people who always who never said to me that doctor, I am regretting because I took vaccine, but instead they always tend to tell that doctor, if I would have known that there would have been a prevention for this thing, I would have taken it. So always think about this. Okay. There are some vaccine injections which claim to be non-painful as they good as they might be having pain suppressors too. I don't think so because pain suppressors, when they are mixed with the vaccine, the vaccine can cross react with it. Yeah, but multiple good hospitals like Reliance and all, they tend to give um local anesthesia, that is tropical anesthesia, and give injections. So it is mainly painless. But I think something which you are getting permanent, you should always get some pain. All permanent things should come with some pain. Yeah. And next is MDR TB is also very common nowadays. Is just avoiding antibiotics could be good option for minor diseases to stop taking TB drug resistant. MDR TB is very different thing. I think it's little bit off the topic. Uh, MDR TB, the cause is different. The TB patients who are not taking their TB medications regularly, they tend to go in more of a multi-drug resistant tuberculosis. So minor diseases, but yeah, always a good option for not taking antibiotics is avoiding antibiotics is always a good option because it reduces the drug resistance. But MDR TB is different. It is not because of people taking more antibiotics, but it is more of people not compliant with that tuberculosis medication, or multiple they are infected with HIV or something like that. There are some superimposed diseases which has caused the TB to turn into multi-drug resistant. So there is different thing. Okay, next. So any question answer, I'm ready to take all the question and answer. Whatever you want to ask, you can ask.
And if anyone wants to speak with the doctor, just raise your hand. I will allow to talk.
Yeah, no issues.
If anyone have any questions.
Any questions? Maybe I would suggest it should be related to vaccination,
Yeah.
because I think most of the people will ask something related to the emergency and critical care. For that, we'll conduct one more thing, one more
Sure.
session for you. Any questions, you can ask me. Okay,
I
welcome.
think most of them have already asked questions.
Yeah,
So much all audience who have joined for this session and have taken your time for this Friday afternoon. Thank you so much for
nice.
being here, and thank you
It was
so much for
nice. It was nice talking to you all. Let's meet sometime one to one, and we'll talk about more things.